Thank you, Twinkle. Honorable Chief Minister of Meghalaya, Shri Conrad K. Sangma, who's the chief guest in today's inauguration. The Honorable Minister for Health and Family Welfare, Kong Amprin Lingdo. Shri Nandan Nilekani, the former chairman of UDAI and now the chairman of Infosys. Shri Vinod Khosla from Khosla Ventures. Shrikant Nadhamuni, the former CTO of UDAI and now chairman of this 10-bed ICU project. Dr. Sudarshan Hanup Mappa of Karuna Trust. Mr. Nachiket Moore, public health expert and scientist, and Mr. Kaushik Sharma, the senior vice president of HDFC Bank. The officers from the state government of Meghalaya, led by Principal Secretary Shri Sampat Kumar, Commission Secretary Joram Beda, the directors who are here, the joint directors and other officers, all the medical professionals, all the members of various NGOs who are present here this morning, and members of the press, both from the print and electronic media. A very good morning to all of you, and a very happy occasion to be here this morning on this very important and really a landmark day for all of us in the health sector. I'll make it very short because quite a number of speakers have spoken and are going to participate. I've been traveling a lot in the past 2 months, in fact, and most of these travels are to the interior areas. One gentleman who's sitting on the dais very quietly without saying a word actually is responsible for setting up about 9, if I'm not mistaken, PHCs in the rural areas. They are all in the back of beyond of Meghalaya. Very, very difficult areas. In fact, I went to Saipung, I got stuck over there, and somehow I managed to reach the public health center over there, and it's Karuna Trust, led by Dr. Sudarshan. It was a fully functional public health center, and I was very, very elated to interact with the doctors over there. It's challenging, you know, the whole area is so difficult to reach, and they did a very, very remarkable job. Same is the case with Aradonga, which I went about maybe a month and a half back. They were there also in full force. Not even a single vacancy was there at a point of time. What I'm trying to say is that it is proven that the public-private partnership has worked very effectively in the state. And today, this occasion also marks one more step of public-private partnership in which critical care units will be set up in 14 hospitals all over the state. But being a bureaucrat, you know, we always tend to look with a microscope. And to err on the side of caution, I request the health department to kindly look at a few issues. This is a huge, humongous step, and it is just the first step. It's not that the ICUs have been set up and it's done. In fact, challenges will come from now on. We have seen it just 4 or 5 days back. I was in Baghmara District Hospital, and we have seen the challenges over there. We need for an ICU trained doctors. We need for the ICU trained nurses, which is very, very important. And the third pillar, which is equally important but mostly forgotten, we need trained ICU technicians. And it's very, very difficult to get trained ICU technicians because if any instrument breaks down, a lab technician will not do it. You need specialist technicians. So I request the health department to kindly have a look at all these aspects and ensure that a standard protocol is made to ensure that within a flick of a button, everything is solved and all the personnel are placed at the right places. Second is that let the units that are formed meet the IPHS standards and also ensure that, for example, nurses, you'll be needing 1 nurse for 2 patients. That's a huge number cutting across the whole state. That is the standard. And when it comes to infrastructure, also it's going to be quite challenging because you'll need a fully AC ICU in a place like Baghmara, in a place like, William Nagar and all that. It may be a bit difficult. But I'm sure that if you are prepared for it, so the whole point I'm trying to make is that you have to be prepared from now on. It's not that it's inaugurated, it's done, it'll start functioning automatically. No, a lot of training has to take place, a lot of capacity building has to take place, and a lot of follow-up. Somebody was talking about just now that leadership is important. Yes, we can see the leadership at the top. The Honorable Chief Minister is here, the Health Minister is here, the commitment is there. But the leadership has to percolate down to the local level. Wherever the hospital is there, wherever the CHC is there, the leadership of the local doctor is most imperative. So I request from the director's side, the health department side, to send this message across that it's important that local leadership is also there. You will have problems. Infrastructure is a big problem, and you'll have problems of power. But of course, now that power has really improved in the state in the last 4 or 5 months, we have not had any major issues. But there has to be redundancy, because an ICU will not work without power. You have to have solar connectivity. Ensure that you have to have generating sets fully functional in remote areas. It's very, very important. Connectivity is not a problem. We are having a tele-ICU hub now. And in this hub and spoke model, if you don't have connectivity, it's going to be very sad. But the good news is that, as Honorable CM was saying, the statewide area network is going to be developed. And in fact, when we were in Ranikor about 2 weeks back, we saw the Reliance Geo network was fully implemented over there in very, very remote areas where even vehicles are difficult to go. But again, it depends on the local leadership. If a bank which was functioning over there doesn't get proper connectivity, in spite of the fact that OFC is running in front of it, it's sad, because nobody's doing anything about it. So it's important that local leadership take it up. The last point I would like to make is, you may say that, okay, you're setting up ICUs and all that. What about the nurses? What about the doctors? We're so short of nurses, so short of doctors. I'm happy to say that since under the leadership of our CM, the recruitment board has been formed, and I'm sure in the month of February, by next month, additional nurses, additional doctors, additional medical personnel, paramedical staff will be again recruited through this board, and I'm sure then everything will be put in place and all the sanctioned posts will be filled. This will be the first time, in fact, in the history of the state that there'll be sanctioned posts less, the vacancy will be less than 2% of the vacancies after that exercise is completed. And that is what is required, and that is what needs to be done. I'm happy that the government is focusing a lot on the social sector, education. We've seen, we went and saw it in Garo Hills last week. All the teachers in the elementary sections, the interview process has been completed, and with the teachers in all the schools, no vacancies again, it will be a game-changing situation in the state. In health, we have seen the recruitment that has been going on, will again continue in the month of January, as I said. It'll be a huge game changer again. And last, in drinking water, this is also one sector that has a lot of focus in the present government. We started in 2018 with 4,600 connections. That is functional household tap connections. 4,600, the lowest in the country. Today, we stand at 4,70,000 functional household tap connections, and increase of 10,000%. Hold your breath. I'm saying 10,000% increment over a period of 5 years, which is really phenomenal. And I must say that all credit should go to the state leadership again in this. And we will continue to work hard as officers, and I'm sure that by next year, we will saturate this. It is important to connect all the three, that is education, drinking water, and health, because they complement each other. And I'm sure if we do our job well, things will improve in the state, and the main beneficiaries will be the common man. Thank you. Mitela Kublai Jai Hind.